Hello everybody, hi, I'm Jewel. Welcome to my channel. Today's topic that I chose is pain medications, analgesics. This information is coming from the National Kidney Foundation, and this is probably going to be a two-part video because it's a lot of information. So, many analgesics should not be used if there is decreased kidney function because they reduce the blood flow to the kidney. Also, long-term use with higher doses may harm normal kidneys. It is important to realize that while helpful, these medicines are not completely without risk, and they should be used carefully. Kidney disease related to analgesics is preventable. What are analgesics? Analgesics are medicines that help to control pain and reduce fever, and some types also decrease inflammation. Examples of analgesics that are available over the counter are aspirin, acetaminophen, ibuprofen, ketoprofen, and naproxen sodium. Prescription strength pain medicines are also available. Some analgesics contain a combination of pain-killing ingredients in one pill, such as aspirin, acetaminophen, and caffeine, that have been linked to kidney disease. These are not as readily available as in the past. Can analgesics hurt kidneys? Check with your doctor to be sure you can use these medicines safely, particularly if you have kidney disease. Heavy or long-term use of some of these medicines, such as ibuprofen, naproxen, and higher dose aspirin, can cause chronic kidney disease known as chronic interstitial nephritis. The warning labels on over-the-counter analgesics tell you not to use these medicines for more than 10 days for pain and more than 3 days for fever. If you have pain and or fever for a longer time, you should see your doctor. The doctor can check for possible medical problems and advise you about what medications you can take. If you have decreased kidney function, painkillers called NSAIDs and higher dose aspirins are not recommended. Even with normal kidney function, you should use analgesics exactly as prescribed or as on the label at the lowest dose possible and for the shortest period of time. Is aspirin safe for regular use? When taken as directed, regular use of aspirin does not increase the risk of kidney disease in people who have normal kidney function. However, taking doses that are too large, usually more than 6 or 8 tablets a day, may temporarily and possibly permanently reduce kidney function. In people with kidney disease, aspirin may increase the tendency to bleed. People who already have reduced kidney function or other health problems such as liver disease or severe heart failure should not use aspirin without seeking a doctor's advice. My doctor recommended that I take aspirin every day to prevent heart attacks. Will this hurt my kidneys? No. There is no evidence of risk regarding the regular use of aspirin in small doses recommended for prevention of heart attacks. Use of a baby aspirin is fine even with reduced kidney function. What analgesics are safe for people who have kidney disease? Acetaminophen, remains the drug of choice for occasional use in patients with kidney disease because bleeding complications that may occur when these patients use aspirin. However, kidney patients who need to use acetaminophen habitually should be supervised by their doctors and be sure to avoid drinking alcohol while on this medicine. What are NSAIDs? Are they safe to take? Non-steroidal anti-inflammatory drugs, NSAIDs, are a specific group of painkillers. Some NSAIDs are available over the counter. This includes different brands of ibuprofen, naproxen sodium, and ketoprofen. NSAIDs are usually safe for occasional use when taken as directed. But if you have known kidney decreased kidney function, they should be avoided. These medicines should only be used under a doctor's care by patients with kidney disease, heart disease, blood pressure, um, or liver disease by people who are 65 or who take diuretic medicines. NSAIDs may cause an increased risk of kidney failure and even progressive kidney damage. Okay, everyone, I'm going to stop right here on this video, and this video is talking about pain medications, analgesics, and as you know, we've all taken pain pills over the counter, which is aspirin, like they said, naproxen, and so on. But they basically give you the information in the package of that they can be a risk to people if they do not take them as directed. So this article is speaking to us, that's telling us that we have to be very, very careful when we're taking these medicines, even if we don't have decreased kidney function, because they can cause kidney damage to people with regular kidney function. And of course, with people with kidney disease, it's even more restrictive, and we should always talk to our doctors about anything that we take. And when I do have little pain or so on, my main choice is Tylenol, because this is what's recommended to me by my doctor. But even then, you can only take so much, and if there is even pain, more pain, you have to talk to your doctor about all these incidents and everything you're going through. So guys, this is pain medicines, analgesics, and if you found any of it useful, please like, share, and subscribe. And of course, take care of yourselves always. We're thinking about you. And of course, always stay compliant. And the last thing I always say, stay positive no matter what you're going through. And I'll see you in the next video.